Hi, good morning or afternoon or evening, whenever you are tuning in. Today's topic that we will be discussing is the cardiovascular system. So I'm going to get my lecture pulled up here and we'll go ahead and get started. There we go. Okay, so again, the cardiovascular system, when we think about the components associated with such, again, we want to kind of hit on the general anatomy of this particular system. So let me get my little pointer, my little laser pointer. So components include the heart, and the heart will act as a pump for us. So it's going to allow us to move the fluid throughout the body. The arterial system, which is in charge of taking blood away from the heart. So the arteries are going to carry blood from the heart to any systemic organs that we have. Capillaries are going to facilitate exchange for us. So again, they'll be located in the at the tissues or within the organs. And it's going to allow us to move items from inside of the bloodstream into the tissues so that we can use like oxygen and nutrients. And it's also going to allow us to get waste products from inside those tissues, such as CO2, hydrogen, etc., and put those into the blood so that we can get rid of them. Okay. The venous system is in charge of carrying blood away from the organs. Okay, so the veins are going to bring blood back to the heart. And then certainly we know that blood will serve as our medium of transportation for nutrients, oxygen, CO2, waste products, etc. Okay. So when we think about, there are 6 functions of the cardiovascular system. Function number 1, delivery of oxygen and nutrients. So again, the blood is in charge of carrying those oxygen and nutrients to all of our organs and muscles, etc., within the body. Number 2, removal of CO2 and waste products. So again, within those capillaries, we'll be able to pick up those waste products and get rid of them through a variety of excretion processes. Number 3, transport hormones. So again, within the endocrine system, the blood will serve as our mechanism for transport. Number 4, thermoregulation. So it turns out that blood is an excellent way for us to carry heat. So we can either vasoconstrict vessels, and that'll allow us to keep our heat like at our core. We'll do that in cold environments, or we can send blood to the skin surface, which is known as vasoconstriction, and that'll allow us to dissipate heat. So again, if anybody gets kind of like flushed cheeks, or maybe your face gets red, something like that, either in a hot environment or like when you're exercising. The reason for that is because we're bringing blood to the skin surface so that we can dissipate that heat in that way. So that's number 4. Number 5 is maintenance of acid-base balance. So again, within the blood or within the body, we have many mechanisms that are going to allow us to maintain homeostasis, which is kind of like maintaining a stable environment. And one of those components involves us keeping the appropriate number of acidic molecules balanced with the number of basic molecules that we have. So we want to maintain that within kind of a small range. So the cardiovascular system will certainly play an important role in that. And then lastly, immune function. As we know, the white blood cells are part of our composition of our blood, and those will play an important role in immunity or immune function. Okay, so when we think about the blood, so we're going to look at each of these components kind of separately so that we can understand their anatomy and the different elements within. So the blood is composed of really 2 different things. We have blood plasma, which is basically like the fluid portion, and then we have formed elements, which are the blood cells and platelets. Blood accounts for about 8% of our total body mass. An individual that's actually like super fit might even have a little more blood than that. And that's a positive chronic change that we can make to regular exercise. It allows us to carry more oxygen. It allows us a greater capacity for thermoregulation. And it allows us to, overall perform better from an athletic or exercise standpoint. So more blood is better. Okay. Normal blood volume, 5 to 6 liters for men and 4 to 5 liters for females. Again, not really anything specific to differences within the genders. This is more based on body size as opposed to, any actual differences within biology as it's associated with someone's sex. Blood plasma. Again, this makes up about 55% of our blood volume. It's pretty much water, so 90% water. It also contains many other ions or other molecules. Molecules included in the blood plasma include sodium and potassium. Okay, it'll include nutrients such as sugar, amino acids, and lipids. It will include some waste products such as urea, ammonia, and CO2 or carbon dioxide. It'll include oxygen, hormones, and vitamins. And it includes 3 types of protein molecules, which are going to assist in transportation and also blood clotting. And those hormone molecules include albumin, globulin, and fibrinogen. Okay, so I'm going to just repeat everything that's in the plasma again. So if you need to pause this now, that might be a good thing to do. So it includes ions such as sodium and chloride, nutrients such as sugars, amino acids, and lipids, waste products such as urea, ammonia, and CO2 or carbon dioxide, oxygen, hormones, and vitamins, and proteins such as albumin, globulin, and fibrinogen. And these are going to assist in transportation within the blood and also will assist when we need to do blood clotting. Okay. Again, the formed elements are the other component of the blood. Again, these are pretty much blood cells. So the majority of our formed elements are known as erythrocytes or red blood cells. We also have platelets or cell fragments, and then a small percentage of our blood cells are white blood cells, which we know will play an important role with immune function. Again, about 45% of our blood volume coming from these formed elements. Males tend to have slightly more than our females. And again, that has to do with the amount of red blood cells that we have. And that has to do with the amount of iron that we have. So again, males tend to have a little bit more, which means that they have a higher oxygen carrying capacity, which means that they would perform better from an aerobic standpoint in comparison to females. Again, having more testosterone will kind of enhance the amount of red blood cells that I could potentially have. So that's one of the benefits from a male perspective as it's associated with aerobic metabolism. Yeah, I think that's it on that slide. This is cool. I think this is super interesting. So this kind of shows you what the red blood cells look like. And basically, they're kind of like a donut shape. So imagine you got like one of those round donuts with the hole in the middle, but there was enough frosting on top that the hole kind of filled in. Like that's the best kind of donut, is we need to maximize the amount of frosting that we have. And basically it creates this biconcave shape. Okay, so biconcave, so you have 2 concave surfaces here. Okay, so again, you can see the concave surface here, and you can see a concave surface here. So again, imagine it like a filled in inner tube, or, like I said, a donut with frosting that kind of filled in that hole, right? And that's kind of what the red blood cell looks like. Okay, red blood cells contain hemoglobin, which you can see here, and each red blood cell has 4 different binding sites. So you would have like a binding site here, here, and then on the bottom here and here. And those hemoglobin binding sites are going to allow us a location for oxygen to attach, basically, and therefore they're going to carry that oxygen for us. Okay, so the job of the red blood cell is to carry oxygen wherever we need it, and the way in which we're going to do that is the attachment through 4 different hemoglobin binding sites on each red blood cell. Okay. One other interesting thing to note about red blood cells that I think is super ironic and interesting is that red blood cells don't have a mitochondria, so therefore they rely exclusively on anaerobic metabolism in order to stay alive. Okay, so again, when you think about the job of this molecule, its job is to carry oxygen, and we use oxygen for aerobic metabolism, okay? This molecule doesn't even have the capacity to utilize that oxygen. So it's an excellent carrier for that oxygen because it never utilizes its product. Also pretty ironic, I think, to think about that this guy spends his whole life carrying oxygen around all over the body and he never ever uses any of it. So kind of ironic that his job, you know, he doesn't get to enjoy the use of oxygen or something along those lines. But I think that's kind of an interesting thought. All right, what else? Special characteristics that we see with red blood cells. Again, that biconcave shape that we showed, that kind of, you know, two kind of divots basically. So concave like this, and then it's concave on the other side like that. And again, the reason for that is it facilitates easier attachment of oxygen to the molecule. Okay, so it provides more surface area, allowing more rapid movement of oxygen. Okay. Made up of about 97% hemoglobin. So as I mentioned in the previous slide, we have 4 different hemoglobin molecules, so we can bind 4 oxygen molecules. Again, as mentioned on the previous slide, it lacks mitochondria, so it's completely anaerobic in nature. So that means that it doesn't ever consume any of the oxygen that it's carrying, so it's very efficient at carrying oxygen. Okay, let's take a look at our white blood cells as well. So our white blood cells account for approximately 1% of the total amount of blood cells that we have. And white blood cells are going to originate in the bone marrow. Okay, so that's where they're produced originally. And we can subdivide them into 2 categories. We have granulocytes and agranulocytes. So our granulocytes look grainy in nature. So that would include this eosinophil, the basophil, and the neutrophil. So again, they're granular looking. So those are considered granulocytes. Okay. And then we also have the agranulocytes. Agranulo means without grains. Okay. So this would include those lymphocytes and monocytes. Okay. So again, of the 5 types of white blood cells that we have, the most abundant is going to be the neutrophils. So these are the most abundant. Again, what do we need white blood cells for? They're crucial in our defense against disease. They attack infectious microorganisms, bacteria, viruses, parasites, etc. Again, super interesting. We won't get into a whole lot of the details associated with, you know, how they fight off these diseases, these viruses, etc. That's a whole nother class on immunology that you could take that would give you a lot more information about how these guys do their jobs. But we're just going to kind of hit the surface here and talk about a little bit of their anatomy. Okay. So the last component of those formed elements is made up of platelets. Platelets are also sometimes called thrombocytes or cell fragments. What do we need these platelets for? They're going to plug small tears in the walls of blood vessels and help to initiate blood clotting. So again, if I fall, skin my knee, the platelets are there to kind of plug up the tears within the walls of the vessels, and that's going to prevent me from bleeding out, helps that clotting process begin. So again, protecting myself from losing a large amount of blood volume. How are blood cells formed? They're formed through a product or a process known as hemopoiesis or hematopoiesis. Again, these terms can be used interchangeably. Poiesis means to build. Hemato or hemo has to do with blood. So again, we're forming new blood cells. Bone marrow is the site for blood cell formation. Red bone marrow is generally where blood cells are going to be formed. Yellow bone marrow can help out, but only in emergency situations. So if I lost a lot of blood or something along those lines, or I had some sort of issue with my red marrow, then the yellow marrow would kick it up a notch and help us in that emergency scenario. We produce approximately 100 billion new cells every single day. Isn't that crazy? So again, we think about the value or the importance of this red marrow. That's pretty freaking important. You're producing a net of 100 billion new cells each day. Okay. So when we think about disorders of the blood, I chose a very common disorder to kind of look at here. Anemia has to do with red blood cells or hemoglobin concentrations being low. And again, if I don't have enough hemoglobin or I don't have enough red blood cells, this allows me or causes me to have a diminished capacity to carry oxygen. Can be caused by a few different things. Could be iron deficiency as it relates to nutrition, or it could be related to absorption of iron within the diet. Blood loss, a genetic defect associated with the hemoglobin. So again, that could be something like sickle cell anemia, not as common, you know, just this general term of anemia, significantly more common than having some sort of genetic defect of our hemoglobin. Symptoms of anemia include you feel tired, pale. Again, the reason that you feel pale or that you look pale is because hemoglobin provides us with that red tint or that pinkish hue within our skin. So if I don't have enough of that, my skin might appear to be pale, which can be hard to differentiate. You know, a lot of people in the winter months just look pale in general. So it would be hard to kind of differentiate those particular symptoms. Shortness of breath, cold as well. So tissues have low metabolic rate because they're not receiving enough oxygen. Again, metabolism, one of its byproducts is heat. So again, you might feel cold because you're not burning as many calories necessarily. Another, I guess, it's super common during pregnancy as well, because again, now I have to provide iron for this fetus in addition to myself. And again, I need to increase the amount of red blood cells that I have in my body, like blood volume increases up to 40% with pregnancy. So super easy to become anemic in that particular scenario as well. So you're not just trying to maintain, you're trying to build more than what you had to kind of start with. Okay, one other disorder associated with blood, leukemia. So this is a form of cancer that's associated with the overproduction of those white blood cells within the bone marrow. Two different kind of branches, I think, associated. Again, this is very simplified. We could talk in greater detail about more subdivisions within leukemia, but I can have acute or rapid advancing leukemia, or I can have chronic or slow advancing leukemia. With acute leukemia, again, things are going to happen very quickly. With the chronic or slow advancing leukemia, I might be able to live a normal life for many years with this particular disease because it's coming on slowly, essentially. So cancer cells take over the bone marrow, and this slows the production of normal blood cells. So again, these cancer cells are kind of taking the place of production as it relates to the normal blood cells. Infections and hemorrhages are usually the cause of death for these particular people. Again, I can't fight infections as effectively as I would be able to if I had a normal distribution of blood cells. And then hemorrhages could occur additionally because I have this kind of imbalance of healthy cells in comparison to cancer cells. All right, so again, that gives us some kind of general information as it relates to the blood. And the next component of the cardiovascular system that we're going to talk about is the myocardium. Myo means muscle, cardium means heart. So the term myocardium, we're talking about the heart. Okay, so let's take a look at some of the anatomy associated with such. So first thing we want to do is understand the location and orientation of the heart. Again, you can see here that it kind of lies in between both of our lungs. Okay. Other important things to note, the apex of the heart is here kind of at the bottom. The base of the heart is actually at the top, or more superior in nature. Notice that we have several vessels that are exiting superiorly out of the heart. We have the aorta, which is going to carry blood to the entire body. And then the vena cava, which is our major vein that's going to bring blood back to the heart. And then we also have the pulmonary trunk, which is going to take our blood to pulmonic circulation, which is the lungs. Okay. Again, conveniently located here, superior side of the heart, and conveniently located close to the lungs. And again, we'll talk in more detail about what that is and how that works here in just a second. So we have several coverings associated with protection and lubrication within the heart. It's contained within a triple layered sac. Okay, so again, if you remember back to lecture number 1, we talked about these kind of serous layers and how important they are at preventing friction. Again, if you think about the heart's contracting 60 times a minute, every day of your life. Oh, hang on. Dogs are barking. Okay, sorry, dogs freaked out for a second there. Let me get back to the PowerPoint here and we'll continue on. So we were just talking about the structure of the heart and some of these coverings that we have, right? So we have the outer layer is a sac that's composed of fibrous pericardium. So again, that's going to be your most superficial of the layers. And then next we have the serous pericardium, which will lie intermediate. And then the most deep of these layers is the epicardium. Again, epi means upon, and epicardium is going to lie directly upon the top of the heart. Okay. Other things to note associated with each of these layers: the fibrous pericardium is made of a dense connective tissue, and again, that's going to be a protective covering that's going to be pretty strong in nature. That serous pericardium is going to contain serous fluid that's going to help reduce the friction as the heart beats. And then the epicardium, as we mentioned, lies the most deep of these layers, and that's actually going to be made up of the visceral and parietal pericardium. Okay, so again, if I were to layer each of them, most external, fibrous pericardium, then serous pericardium, then parietal epicardium, and then visceral epicardium. Okay, so again, those are the kind of the 4 layers associated with the heart. Okay, again, if we zoom in even further, we can take a look at what's going on internally within the heart as well. So again, we've got that pericardium, which is the outer connective tissue layer. Peri means around, so this is going to surround the heart itself. You can see the epicardium, myocardium. So again, this is the muscular layer associated with the heart. And then the most internal of the layers of the heart wall involves the endocardium. And again, this will be kind of that layer that creates the chambers, basically. So again, here you can see one of the heart chambers, and the endocardium will be the layer surrounding that. Okay, so let's take a look at those chambers. Again, the heart is composed of 4 different chambers. So again, we have 2 on the left, 2 on the right. Again, keep in mind that we're looking at this person straight on. So again, my left is on here, on this side, and my right's on this side as I look at him, if that makes sense. But again, keep in mind that you have to remember that this is this person's left side, if that makes sense. Okay. So again, the atrium lie superior. So there are these upper chambers, and then the ventricles are going to be inferior, and those lie here. Okay. And we can also take a look at the difference between the left and right sides. Okay. So notice that the left side, the wall is slightly thicker. Okay. And that's because the left side is going to deliver blood to the whole body. So this side needs to be stronger in comparison to the right side. The right side is going to send blood to the pulmonic system or straight to the lungs. Again, based on the location of the lungs, it's really not that far away, so it's easy for us to send blood to the lungs. This side doesn't need to be as strong. Right? Other things to note, we have a valve that's going to separate the atria from the ventricle on both sides. On the right side, we have the tricuspid valve. So again, basically, this valve is made up of 3 different little flaps that kind of fold together. The left valve is known as the bicuspid valve or the mitral valve. And again, that's going to be made of 2 flaps, essentially. Then we have semilunar valves, and these are like moon-shaped, basically. And the semilunar valves are going to be found in the aortic and pulmonary arteries. Okay. Also notice that we have something known as chordae tendineae, and that's these kind of string-like projections that allow us to keep that flap attached to the walls of the chamber. Okay. So again, things to note here, tricuspid valve is on the right side, bicuspid valve, which is also sometimes called the mitral valve, is found on the left side. And then these semilunar valves can be found in both the aorta and the pulmonary artery. Okay, more about the heart valve. So again, here you can see that the aortic valve, which is semilunar in nature, again, looks like 2 little moons, and the pulmonary valve, which is also semilunar in nature. Again, tricuspid, we said, was on the right side, and the mitral or bicuspid valve is located on the left side. Chordae tendineae, so I mentioned this again on the previous slide. So basically it's kind of these like string-like projections or tendinous cords that are going to connect the valve to the papillary muscles. Okay, so here you can see papillary muscles, and these cords are kind of attaching that valve to those muscles. As those muscles contract, this will allow the cords to pull the valve open, and that allows blood to flow from one chamber into the next. Okay, so again, let me go over that one more time. The chordae tendineae are connected to both of the atrioventricular valves, so both the tricuspid and the bicuspid valves. Okay, so again, in both valves that are separating the atria from the ventricles. Okay. And these cords are connected to papillary muscles. And as the papillary muscles contract, they're going to pull the cords. And this allows us to open that valve up. And that's going to allow blood to flow from this chamber down into this chamber. Okay. So the next thing we're going to look at is kind of the basic circulation associated with the cardiovascular system. Okay. So here you can see, again, I've got a couple different images of this because I'm a visual person and I like to kind of show it in different ways. Whatever works for you is great though. Okay. So the left side of the heart is known as our systemic circulation, and our right side of the heart is known as pulmonary circulation or pulmonic circulation. And the atrias are going to lead into the ventricles. And then the ventricles are in charge of sending that blood out into the world. Okay, so let's start on the left side. So on the left side, I'm going to move from the left atria through that left mitral or left bicuspid valve into the ventricle. And then the left ventricle, again, needs to be the strongest of all the chambers in the heart because it's in charge of sending blood out to the systemic circulation or to the entire system, okay? So I'm going to send blood out of the left ventricle into systemic arteries. They're going to drop blood off at the systemic capillaries where exchange can occur. I'm going to drop off oxygen and nutrients. I'm going to pick up waste products. I'm going to carry those waste products back to the heart through the systemic veins. Once they get close to the heart, they're going to enter into the right side. Again, this is known as deoxygenated blood over here on the right side. And that's going to dump into the right atria. The right atria is going to kick that blood down to the right ventricle. That right ventricle is going to send blood through those semilunar valves into the pulmonary arteries. Again, the arteries are going to take blood away from the heart. In this particular scenario, those pulmonary arteries are going to drop blood off at the pulmonary capillaries, which is going to allow me to pick up oxygen at the level of the lungs and get rid of my CO2 or waste products at this level as well. Once I am oxygenated, I'm going to come back the pulmonary veins and enter into the left side of the heart because now I'm ready to be sent out to the whole body because I've picked up my oxygen. I'm ready to go. Okay. Again, this just shows you another image of how blood is going to flow through each of these vessels. Okay. So I'm trying to think. Let's start in the same location. So let's start with the left atrium. Again, we're picking blood up from the pulmonary veins, so this is oxygenated blood. The pulmonary veins lead to the left atrium. We're going to go through the mitral valve or that bicuspid valve to the left ventricle. The left ventricle is going to send blood out to the aorta. The aorta will deliver blood to the entire body. Okay. Once we drop off oxygen, nutrients, pick up waste, we're going to return that blood through the vena cava, which is just these blue tubes here. We have an inferior vena cava and superior vena cava. That's going to dump into the right atria. We're going to move from the right atria to the right ventricle through the tricuspid valve. The right ventricle will contract, and that allows us to send blood out through the pulmonary artery. Okay, so it must pass through this semilunar pulmonary valve into the pulmonary artery where I can deliver that blood to the lungs, and therefore I can pick up oxygen and get rid of my CO2 in that location. Once I've done that, the blood will come back the pulmonary veins and enter into the left circulation. Again, just one more example. This gives you no new information, but just shows you kind of the flow of blood. Like I said, I'm kind of a visual learner, so looking at these different images is helpful for me to kind of visualize what's actually going on. So again, takeaway, we move from the atria to the ventricle, and left side sends blood to the whole body, right side sends blood just to the lungs. Okay. Other things to note when we think about that cardiac muscle tissue in particular, again, just kind of focused on this image here. As we look at this from a histological standpoint, so the cardiac muscle is striated, branched, uninucleated, so it has one nuclei per cell. Again, where is it located? It's located in the walls of the heart, and it is involuntary in nature. So again, its contraction doesn't require us to cognitively think about anything. Okay. Reasons that it's branched. So again, this I think is super interesting when we compare this to kind of this tubular arrangement that we see within the skeletal muscle. Again, imagine when a skeletal muscle contracts, I want to shorten everything because that's going to create a lever system that's going to allow me to have movement occurring. Now, the difference when we think about a heart, which is kind of like a ball-shaped thing, like a little, I don't know, like that kind of, is in order for me to have movement occurring associated with the blood, I need to contract everything at the same time. So being able to shorten just one side of the heart isn't going to cut it for us. So it's important that we have this branched configuration so that everything within that chamber is occurring at the same time. So when we want to have that contraction, we can have everything work together because everything's kind of intertwined, as opposed to with skeletal muscle where it's just kind of in a straight line. Okay. Okay, so again, you can see from a histological standpoint kind of what this looks like. Again, you can see the striation, so it is striped in nature, uninucleated, so again, you can see one nuclei per cell. What else? It's branched, so again, you can see that it's kind of like going like this as opposed to just in a nice straight line. What else? Oh, these intercalated discs, that's one thing I should mention. These interlock the cells. That's kind of like locking your fingers together. So again, imagine this configuration versus this. Again, this is intercalated discs, and again, that's much more stable in comparison to this configuration. Okay, so again, why is it important for our fingers to be locked together during or within the cardiac tissue? Again, this is important for us in order to establish kind of this uniform contraction of the heart. Specifically, if I'm doing something with high intensity where I need to freaking get my blood going, right? So if I'm doing some sort of exercise or strenuous task, I need to be able to be as precise as possible with these contractions. Okay, when we think about blood supply to the heart, again, remember that this heart muscle is a muscle, okay? So we also need to supply oxygen and nutrients in order to keep this muscle fueled. Again, this muscle is debatably the most important muscle in the body, right? It works all the time from the day before you're born until you die, right? You can detect heartbeat in babies as young as 5 weeks pregnant. Heart rate can be detected. Okay, so imagine that you have this organ within your body that's contracting literally every minute of every day from before you're born till the day you die, right? So how freaking cool is that? It never messes up, it never takes a break, like it is constantly doing its job, and it does a great job, right? Even for unhealthy people, we're able to sustain cardiovascular contractions for the majority of their lives without any issues. So I think that's just absolutely remarkable. Super important that we're then fueling this muscle because of the importance of the work that it does, right? So we have these coronary arteries, and our coronary arteries are going to supply the heart muscle with oxygen and nutrients, okay? So again, you can see lots of them. So again, it's very dense in nature. So you can see, you know, the left coronary artery, circumflex branch, etc. I don't care if you memorize the names of these, that's not important to me, but I do think you need to understand what are the coronary arteries and what's their purpose, what's their job, okay? These vessels are also unique in terms of when they deliver blood to the tissue. So again, imagine that with each contraction, I'm squeezing the heart, basically, okay? So these vessels can only deliver oxygen and nutrients when the heart is resting, okay? So again, between each contraction, we're sending blood into these arteries so that we can deliver oxygen and nutrients to the heart tissue. It's very, very important that these vessels work appropriately. If they don't, that's what a heart attack is. It's very important because the myocardial tissue cannot function non-oxidatively. So these cells have to have oxygen constantly. So we absolutely need to have oxygen going to these muscles at all times. Okay, a couple notes to think about when we think about disorders associated with that heart organ itself. So here we can see coronary artery disease. Again, one of the most common issues that we see within the cardiovascular system. basically the arteries supplying the heart are going to be narrowed or blocked, and this is due to fatty buildup or plaque buildup, can cause a heart attack. So angina pectoris is like chest pain, and then myocardial infarction is the actual heart attack itself. Again, basically coronary artery disease is just fatty deposits on the wall. Angina pectoris is heart pain caused by a weakened heart because we're not getting enough blood flow to the tissue. And then, like I said, MI or myocardial infarction is also known as heart attack. Again, what causes coronary artery disease? Pretty much sedentary lifestyle and not eating appropriate things, right? So again, eating unhealthy, too much fats, too much saturated fats can lead to those saturated fats kind of building up. Okay, next section, we've got blood vessels. This is one of my favorite sections to take a look at the anatomy and some of the differences associated with each of these blood vessels. Okay. So again, kind of general fundamentals associated with blood vessels. The artery is going to take blood away from the heart. Capillaries are going to facilitate exchange. So again, they're very small in nature. And then lastly, the veins are going to carry blood back to the heart. Okay. What are the differences between these vessels? We'll certainly take a look at what's going on from an anatomical standpoint. Arteries have thick elastic walls. And the veins are not quite as elastic in nature, and they're known as sometimes called capacitant vessels, and we'll talk about what that means here in just a hot second. Let's see. So again, I like this image. This shows us kind of the difference in many ways associated with function and structure of the arteries, capillaries, and veins. Okay. So as mentioned, the arteries are going to carry blood away from the heart. They're made of 3 layers generally. So they have a muscular layer, which is going to allow us to manipulate where we send blood to. So we can either vasoconstrict or make your vessel very small, or we can vasodilate, which is going to make our vessel very large. And that'll help us to determine where we want to send that blood to. Again, job to carry blood away from the heart to the organs and tissues. Capillaries, the walls of the capillaries are very thin, so they're only 1 cell thick. Again, they're very small in nature, and that's good because they're going to then allow us to facilitate exchange. Notice that a capillary bed contains many capillaries, so lots of vessels here, lots of skinny little vessels, and again, that's going to help us to facilitate exchange at the level of a tissue or organ. Veins are going to carry blood back to the heart. They're larger in diameter. They also have some valves, which is going to help us to maintain blood flow back to the heart because we're going to have a decrease in pressure in this particular location as well as speed. We need the activity of muscles to keep the blood moving. So if the contraction of like our skeletal muscle, for example, is what allows us to not have blood pooling at our ankles and feet and things like that. Again, what's the function? It's going to carry oxygen poor blood from the cells back to the heart. Okay. So arteries, again, we can kind of divide these depending on their size. So we're going to start with the largest, which are elastic arteries. Then we're going to move to muscular arteries, then to arterioles, which are a small artery, and then lastly into capillaries. Okay, so elastic arteries are going to lead out of the heart, and these have the widest diameter. And again, as the name suggests, they're very elastic in nature. And that's important because I want you to think about the difference between the contraction of the heart and a flow of steady state blood, right? So again, imagine the heart contracting, and each contraction, whoosh, we're sending a big chunk of blood out of the heart, right? So we're spurting out blood every second or so, okay? And so these vessels have to be elastic because they need to be able to accept this large bolus of blood in order to not rupture, basically. Okay. Again, the other benefit of this elastic within these arteries is it's going to allow us to kind of even that blood flow out. So again, we don't want to have this kind of pulsatile flow of blood in every place in our body, just at the exit of the heart. So therefore, you know, we're going to stretch out the vessel so that it can receive that whoosh of blood. And then that's going to help us to like kind of level into a more steady state flow of blood kind of later down the road. Okay. Muscular arteries have a thick muscular layer in the middle, and we can manipulate the diameter of these arteries depending on what the scenario is. Okay, so the smooth muscle layer that's found within these muscular arterioles can be constricted, and that would prevent us from sending blood to a particular area, or they can be vasodilated so that we can send more blood to that particular area. Okay, so during digestion, for example, I'm going to have vasodilation to the digestive organs. Okay, so I'm sending more blood to the stomach, to the intestines, etc., so that we can do a good job with digestion, right? I'm going to vasoconstrict in that example, or make the vessel smaller for like my leg muscles, for example. I don't need blood going to my legs so much if I'm interested in digestion. Okay, the reverse is true as well. So let's say I wanted to go for a run. Okay, I'm going to vasodilate or make the vessels leading to my leg muscles really big so I can send more blood to those particular locations. I'm going to vasoconstrict or make the vessel very small for blood flow to the digestive organs. Again, I don't need to send blood to my stomach if I'm interested in going for a run. Okay, so again, we can manipulate blood flow, which I think is freaking cool. Okay. Arterioles, again, smallest of the arteries, and then those will lead us into capillaries. Let's see, what do you want to know about pre-capillary sphincters? So again, here you can see the artery leading into the capillaries, and then the capillaries leading back to the veins. Okay, we have these pre-capillary sphincters, which are smooth muscle that help us to regulate blood flow. So when the tissue is active, the sphincter will open, and that'll allow blood to flow into that capillary bed. If this tissue doesn't need any blood, the sphincter will remain closed, and the blood will go around the capillary bed and into the veins. Okay, let's take a look at capillaries and their kind of fundamental anatomy. So again, the smallest vessels that we have, a diameter is just large enough to sneak one red blood cell through. Okay, and they're made of a single wall. So the walls are composed of a single layer of endothelial cells. Again, that's good because that's going to allow us to facilitate exchange of molecules inside the cell out, and also from outside the cell in. Okay, so that's where we're going to have movement of items in this kind of dynamic way from inside the cell to outside and vice versa. Next, the veins. Again, this is the tube that's going to allow us to send blood from the capillaries back to the heart. Okay, so it's going to allow us to carry that deoxygenated blood. I have it as deoxygenated because it still has quite a bit of oxygen in it, certainly depending on what the scenario is, but like we still have a decent amount of oxygen in that particular blood. Oh, excuse me. These are much thinner walls in comparison to what we see in the arteries, and they do not contain any smooth muscle. So how do veins ensure movement of the blood back to the heart? Three different things that they're going to have. So number one, they have one-way valves. Number two, they have a thoracic respiratory pump. And number three, they have a skeletal muscle pump. So let's talk about what each of those means. Okay, so one-way valves can be found inside of the vessels, and that's going to prevent backflow of the blood. Again, it's going to help me remember, like, your veins got to carry blood from your feet against gravity all the way back up to your heart. And the vessel walls themselves are pretty darn thin. So again, imagine that there's not a whole lot of pressure within this particular vessel as well. Okay, so those one-way valves are going to help us to maintain this unidirectional flow. The thoracic respiratory pump and the skeletal muscle pump are important because those are related to creating more pressure. Okay, so skeletal muscle pump. So as I contract any of my skeletal muscles, the contraction of those muscles is going to increase pressure within that area. So again, for example, walking around, as I contract the muscles in my legs, that's going to allow me to produce more pressure and prevent the blood from pooling and help to facilitate movement of that blood back up to the heart. Okay. Thoracic respiratory pump is kind of the same situation as the skeletal muscle pump, but now we're talking about what's going on within the respiratory region. So again, when I breathe in and take a big breath in, think about the amount of pressure that I'm building in that particular area, right? So with this thoracic respiratory pump, as I inhale, particularly if I take big breaths, that's going to facilitate more pressure as well, and that's going to help us to facilitate movement of blood back to the heart. If anybody's ever been in a summer wedding, for example, one thing that the photographer sometimes will tell you is make sure you don't lock your knees out. Keep your knees slightly bent when you're standing up there in the heat or whatever, especially, guys in tuxedos, or you have several layers on. And the reason for that is if I keep my knees slightly bent, I am then activating the skeletal muscle pump, and that'll prevent blood from pooling in my feet, and that's going to help me to not pass out, basically. So that's one kind of application for you on a summer day. So, all right, this image I freaking love, so it's probably going to be on the test quite a bit. So let's take a look at what's going on here. So, there we go. Okay. So here you can see the different vessels. So I have arteries, arterioles, capillaries, venules, which are small veins, and then big veins. Okay. Now here at the bottom, you can see three different variables. We can look at speed of blood flow, we can look at pressure, and we can look at total area. Okay. So let's start by trying to understand pressure. Okay. When we look at pressure as it relates to blood movement, in order for blood to flow, we have to establish a pressure gradient, which tells us that the pressure exiting the aorta, or the pressure entering into the arteries, must be the highest pressure of the whole system. Okay. Think of like going downstream. Okay. The pressure has to be greatest where I start in order to maintain unidirectional flow, which means that the blood continues to flow down through each of the tubes. If the pressure was great in the veins, that would allow me to, or cause me to, push blood back into the capillaries, which I do not want to do, right? I want to maintain unidirectional blood flow. Okay. So again, with looking at this blue line, you can see pressure is greatest in the arteries, pressure decreases substantially in the capillaries, but it's even slightly lower as we move to the veins. And that's important because this pressure gradient is what allows me to maintain unidirectional blood flow, or blood flow in one particular direction. Okay. Oh, next, let's look at total area. I'm going to give you like a weird example on this one. So, okay, total area. Okay, so again, notice how big this tube is. The artery, very big, and the vein, also pretty darn big. Okay, the total area is about the same at the large arteries as it is at the large veins. Now notice that the total area in the capillaries is significantly greater. Okay. However, we know that each individual capillary is very, very small in nature. Okay. So notice that there are significantly more capillaries in comparison to arteries or veins. So I only have a few arteries and veins, but they're really thick. Capillaries, I've got like millions, but they're really thin or small. Okay, so here's my example with this. This is weird. So imagine like a enclosed water slide, okay, like a big tube, okay? Imagine that the artery is like the where you enter into the tube at the top. You're at the top of the slide, and the lifeguard's like, okay, go ahead, and you get in the tube, okay? Artery is the start of the tube, okay? Now imagine that you had like 1,000,000 straws, okay? Now each individual straw is obviously smaller than the size of that water slide tube, right? But if I had 1,000,000 straws and I tried to fill them like with the like inside of that water tube, I have more straws than can fit. The total area of those straws is significantly greater in comparison to just one single tube, even though that tube is pretty darn big. Does that make sense? Hopefully. Again, the veins are the same. Oops. So the veins have a large water slide tube. The capillaries are like 1,000,000 little straws that would take up more room than one of those water slide tubes. Okay, so total area is significantly greater in the capillaries. The reason that that's important is the more little straws I have, or the more little capillaries I have, the greater job I can do at facilitating exchange. So that is a good thing. That is what we want. Now, in addition, it's important that we understand velocity is inversely related to area, okay? So velocity is going to be high when I have a low area. Velocity slows down when I have this big open area and I have all these different tubes, okay? That's good. We want velocity to be low in the capillaries, and the reason for that is it facilitates more exchange. So it's important that we have a smaller velocity or a lower velocity when we're in the capillaries, because that sets us up well to drop things off and pick things up. Okay. Velocity will pick up a little bit as we enter into those veins because the total area has decreased. Okay. Again, ways to think about what does that mean, like how does that work? Again, velocity is high here. As I increase the area, velocity slows down, and then as area decreases again, velocity will increase. This is just, I think this is pretty. Here you can see the pulmonary circulation. Again, imagine each of these are little arteries or veins that are leading to the lungs. Again, what I want you to take away from this slide is A, it's pretty, but B, it's super dense, right? So again, imagine how many vessels are traveling to the lungs and taking blood away from the lungs. Again, super important, because if I'm not able to pick up oxygen and get rid of my waste products at the levels of the lungs, then the cardiovascular system isn't really that super helpful, right? So again, this configuration of high density of those vessels is super important in order for me to facilitate success. Again, when we think about pulmonary circulation, again, the right side of the heart is responsible for sending blood out. So here you can see the right side in the blue. So we're going to move from the right atria to the right ventricles into the pulmonary arteries. The pulmonary arteries are going to deliver blood to the lungs so that they can pick up oxygen and get rid of wastes. Okay. And then the pulmonary veins are going to bring blood that's oxygenated now back to the left side of the heart so that it can be sent to the systemic circulation. When we think about systemic circulation, again, this just kind of shows you some examples of some of those larger arteries and the names of those. Again, I'm probably not going to test you on specifically where each is located, with the exception of the aorta. You need to know where that is. But otherwise, again, just want to kind of give us an idea of what's going on, make sure that you're familiar with these terms. So from the aorta, we have the ascending arch or I'm sorry, the ascending aorta, which kind of like comes out the top, the aortic arch, descending aorta, and then things are kind of named based on their location. So we have abdominal aorta. So again, that's going to be in the abdominal region. Common iliac artery, going to be in the hip region or pelvic region. Femoral artery, again, going to be kind of in the region of the femur and the leg. Brachiocephalic artery and then carotid artery are going to be more upper. So again, carotid artery is going to take blood to the brain. Brachiocephalic is going to take things to the arm and to the brain. Okay, so here we can kind of see what some of those look like. Again, not really any good tricks here, just kind of want you to be familiar with these different names of those kind of major arteries. Okay, systemic veins, things that you really need to know. Superior vena cava is going to bring blood back into the heart, that deoxygenated blood from the upper extremity, and then the inferior vena cava is going to bring blood up to the heart via kind of the lower extremities, basically. Jugular veins are going to bring blood back to the heart from the brain. Brachiocephalic veins, again, upper extremity and brain. Femoral vein, and then the iliac vein would be both in the femur and iliac region, so within the hip. Again, just make sure you're familiar with these so that you've been exposed to them, not probably something that I'm going to spend a whole lot of time on an exam asking you about, but would be good to be familiar with these. Okay, disorders of blood vessels, so an aneurysm. Here you can, let me move this guy up so you can see a little bit better. So aneurysm, here you can see a widening or outpocketing of an artery or vein that would increase the risk of rupturing, may be due to weakening of the artery wall or hypertension, and we can treat this by replacing that portion of the artery wall. If I don't take care of this, again, it could lead to stroke. Most certainly that would be what we would see in cerebral aneurysm. Okay. Varicose veins is another, I think, super common disorder associated with the blood vessels. And basically what happens if I get varicose veins is those, the veins become enlarged and twisted. It's common in our legs. And basically what happens is those one-way valves that we talked about stop working and blood can flow backwards. So instead of maintaining that unidirectional flow of blood against gravity back up to the heart, blood will sit kind of on those valves break down, and then it stretches the vessels out, resulting in kind of these little outpocketings, basically. Varicose veins, super common in people that have an occupation where they maybe stand all day. For example, like a hairdresser, or maybe like a checker at a Walgreens or whatever. Again, if I'm just standing stationary and I don't have the opportunity to kind of activate that skeletal muscle pump, it's easy for this particular disorder to occur. All right. That is it for cardiovascular system. Again, let me know if you have any questions on this, and I hope you have a wonderful day.